2 organs in your body are working right now with no breaks, no days off, no complaints, and most people will not think about them once today. Your kidneys. 2 fist-sized organs sitting just below your rib cage. Every single minute, they filter approximately 1.3 liters of blood. In 24 hours, they process your entire blood supply roughly 400 times. They regulate your blood pressure, balance your electrolytes, produce hormones that control red blood cell production, and keep your bones from dissolving. They are, without exaggeration, running one of the most sophisticated biological filtration systems ever designed. And here's the part that should stop you cold. Chronic kidney disease affects an estimated 850 million people worldwide. The majority of them had no symptoms until the damage was already advanced. No pain, no obvious warning, just a slow, silent erosion that builds across years, and in many cases is driven almost entirely by everyday choices that most people would never think to question. There are 4 specific threats that the research identifies as primary drivers of kidney damage in people over 50. The 4th one surprises almost everyone because it has nothing to do with eating or drinking. The 3rd hides in plain sight in virtually every medicine cabinet. The 2nd is one most people think they are already managing. And the 1st, the one that causes the most widespread, irreversible damage, is something that the majority of people over 50 consumed this morning, believing it was perfectly safe. Stay with me through this entire video. The most important and least discussed insight comes at around the 7-minute mark. It changes the picture completely. Before the 4 threats, a short piece of biological context, because understanding why the aging kidney is uniquely vulnerable explains why all 4 of these threats are so dangerous after 50 in a way they simply are not at 25. The kidney's core filtration units are called nephrons. Each kidney contains approximately 1 million of them. A nephron consists of a tiny knot of capillaries called the glomerulus, through which blood is filtered under pressure, and a long tubule that reclaims what the body needs and discards the rest as urine. Here is the critical aging biology. From approximately age 40 onward, the kidneys lose roughly 1% of their filtration capacity per year. This is measured as the glomerular filtration rate, or GFR. In a healthy 30-year-old, GFR is around 120 milliliters per minute. By age 70, even in the absence of any disease, it may be closer to 75. The margin for absorbing damage is substantially narrower. At the same time, 2 conditions become dramatically more common in this age group: hypertension and type 2 diabetes. This is not coincidental. These 2 diseases are the leading causes of kidney failure worldwide. Not because they occasionally affect the kidneys, but because both attack the glomerular capillaries directly. Hypertension subjects those fragile filtration vessels to chronic hydraulic stress. Elevated blood glucose causes a process called glycation, where sugar molecules bind to and progressively stiffen the structural proteins in the glomerular membrane, reducing its permeability and eventually destroying it entirely. This means that anything driving or worsening hypertension or blood glucose dysregulation is a direct threat to kidney tissue. And as you will see, all 4 of the threats we are about to discuss do exactly that, through mechanisms that are more specific and more surprising than most people realize. The 4th threat is something most people would never associate with kidney damage at all. The 4th threat is not a substance, it is an absence. Specifically, chronic physical inactivity. This surprises people because the connection is not obvious. But the mechanism is clear and well documented. Renal blood flow, the volume of blood delivered to the kidneys per minute, is one of the most important determinants of filtration efficiency. The kidneys receive approximately 20 to 25% of total cardiac output at rest. When circulation is strong and robust, that flow sustains the filtration pressure that keeps the glomeruli working. When circulation is sluggish, as it does in people who declines, metabolic waste accumulates in the bloodstream. but almost certainly are not managing in the way that matters most for kidney health. Research consistently shows that more than 70% of dietary sodium in Western populations comes from processed food, not from cooking salt. Bread, canned soups, deli meats, sauces, packaged cereals, frozen meals. These products carry sodium concentrations that most people consuming them would find genuinely difficult to believe if they read the labels carefully. The kidney mechanism is direct. When sodium intake chronically exceeds the kidney's regulatory capacity, the body retains water to dilute the sodium load, increasing blood volume. Increased blood volume elevates the hydraulic pressure within the arterial system. Sustained elevation of arterial pressure, hypertension, subjects the glomerular capillaries to chronic mechanical stress far beyond their designed operating range. A useful analogy: the glomerulus is essentially a pressure-driven ultrafiltration membrane. It is designed to operate within a specific pressure window. Chronically elevated systemic blood pressure forces more pressure than that membrane was designed to sustain. Over years, the membrane thickens, scars, and progressively loses its permeability. This is hypertensive nephrosclerosis, one of the two primary pathological pathways to end-stage renal disease. The World Health Organization recommends fewer than 2,000 milligrams of sodium per day. For individuals already managing elevated blood pressure, many nephrology guidelines suggest a target closer to 1,500 milligrams. The average American consumes approximately 3,400 milligrams per day, more than double the upper recommended limit. The most effective intervention is not reduced cooking salt. It is the systematic reduction of processed food consumption. Learning to read nutritional labels for sodium content, not just calories or fat, is one of the most directly kidney-protective dietary habits available. Herbs, spices, citrus, and vinegar provide flavor complexity without sodium burden. Now, here is the first threat. And this is the one where the research reveals something that most popular health content about kidney disease never discusses at all. Stay with me for the next 2 minutes. Before the most important piece of this video, if the depth and scientific precision of this content is what you have been looking for, please subscribe to Golden Glow Senior right now. This channel is built entirely around evidence-grounded health research for people over 50, not trends, not oversimplified advice, the actual mechanisms that determine your health as you age. Subscribing takes seconds and ensures you do not miss what is coming. Now, here is what changes everything. The first and most destructive threat is sugar and refined carbohydrates. Not because of a single mechanism, but because of 4 simultaneous mechanisms operating in parallel. This coordinated assault is what makes this threat categorically more damaging to kidney tissue than the other 3 combined, for most people over 50. Mechanism 1, the diabetic nephropathy pathway. Type 2 diabetes is the single leading cause of end-stage renal disease worldwide, accounting for approximately 40 to 50% of all new dialysis cases in developed countries. And the primary dietary driver of type 2 diabetes development is chronic overconsumption of rapidly digested carbohydrates, refined sugars, white flour products, sweetened beverages, processed starches. When these foods are consumed, they produce rapid and pronounced spikes in blood glucose. The pancreas responds with large insulin secretion. Repeated over years, this pattern progressively desensitizes insulin receptors in skeletal muscle and liver, the primary sites of glucose disposal. The pancreas escalates insulin output to compensate. Eventually, beta cell exhaustion and receptor resistance combine to produce chronically elevated fasting glucose. Type 2 diabetes is established. What happens in the kidney at this stage is devastatingly specific. Chronically elevated blood glucose undergoes a process called non-enzymatic glycation. Sugar molecules chemically bind to the structural proteins of the glomerular basement membrane, a process that generates advanced glycation end products, or AGEs. AGEs cross-link with collagen fibers, progressively stiffening and thickening the glomerular membrane. Simultaneously, elevated glucose activates the protein kinase C pathway in mesangial cells, the structural cells of the glomerulus, stimulating excessive extracellular matrix production that physically occludes the filtration surface. The glomerulus does not simply wear out. It is actively remodeled into scar tissue by the biochemical consequences of sustained hyperglycemia. Mechanism 2. The hypertensive amplification pathway. Research published in the Journal of the American Medical Association and replicated in multiple subsequent trials has established that dietary fructose, the primary sugar in both table sugar and high fructose corn syrup, raises blood pressure through mechanisms independent of sodium. Fructose metabolism in the liver generates uric acid as a byproduct. Uric acid inhibits endothelial nitric oxide synthase, reducing nitric oxide bioavailability in the vascular endothelium. Nitric oxide is the primary vasodilator in arterial walls. Reduced nitric oxide means reduced arterial relaxation, which means elevated vascular resistance and blood pressure. This pathway operates entirely independently of sodium intake, which means a person who carefully restricts salt but continues consuming substantial amounts of added sugar is still generating hypertensive pressure on their glomeruli through this fructose-uric acid nitric oxide pathway. Mechanism 3. Systemic inflammatory activation. Chronically elevated blood glucose activates NF-κB, nuclear factor kappa light chain enhancer of activated B cells, the master transcriptional regulator of inflammatory gene expression. This upregulates cytokine production, including TNF-alpha, IL-6, and IL-1 beta. In the kidney, these inflammatory mediators damage the tubular cells responsible for selective reabsorption, compromise the integrity of the glomerular endothelium, and accelerate the progression of both diabetic and hypertensive nephropathy. Sugar is not merely a metabolic burden. At chronic excess, it is a direct inflammatory driver within the renal parenchyma itself. Mechanism 4. Obesity-mediated hemodynamic stress. Excess dietary sugar that exceeds immediate glycolytic and glycogen storage capacity is converted through de novo lipogenesis, primarily in the liver, into triglycerides. These are packaged into VLDL particles and distributed as body fat. Visceral adiposity, fat accumulation around the abdominal organs, independently increases kidney filtration demand through a mechanism called hyperfiltration. Viscerally obese individuals show elevated GFR not as a sign of kidney strength, but as a sign of pathological overwork. The kidneys are filtering at above normal rates to handle the increased metabolic waste load from excess adipose tissue. Sustained hyperfiltration is a well-documented precursor to glomerular hypertrophy and eventual glomerulosclerosis, scarring that permanently reduces filtration capacity. 4 independent mechanisms, all driven by the same dietary pattern, all converging on the same target tissue. This is why the research increasingly describes chronic sugar overconsumption as the most significant modifiable dietary risk factor for kidney disease in the Western adult population over 50. With the 4 threats clearly mapped, here is what an evidence-supported protective approach actually looks like. For physical inactivity, the minimum effective dose for kidney protection, based on current evidence, is approximately 150 minutes per week of moderate intensity walking. Breaking prolonged sitting with 5 minutes of movement per hour additionally reduces post-meal glucose spikes, a direct glomerular benefit. These are not large time commitments. They are biologically meaningful thresholds. For NSAIDs, the key behavior change is eliminating daily unsupervised use. For chronic pain conditions, a physician-guided review of alternatives, including acetaminophen, topical agents, physical therapy, and anti-inflammatory dietary approaches, is worth pursuing before the next refill. Occasional use for acute pain is a different situation. Daily reliance is the risk pattern. For sodium, the highest impact single change is reducing processed and packaged food consumption. Reading sodium content on labels and choosing products under 400 milligrams of sodium per serving as a working threshold shifts intake toward the protective range without requiring dramatic dietary restructuring. Cooking at home with herbs, spices, and citrus naturally achieves this without any sense of deprivation. For sugar and refined carbohydrates, the most impactful starting point is eliminating sweetened beverages entirely. A single 350 milliliter can of a standard soft drink contains approximately 35 to 40 grams of sugar, roughly equivalent to triggering the same blood glucose response as 8 teaspoons of table sugar consumed at once. Water, sparkling water, unsweetened herbal infusions, and black coffee replace this without the glycemic and fructose uric acid burden. Beyond beverages, replacing refined grain products with whole grain equivalents, where the fiber content slows glucose absorption and reduces glycemic impact, is the second most consequential structural change. None of these changes require pharmaceutical intervention or clinical resources. They require accurate information about mechanisms, which is exactly what you now have. Before the final summary, if the precision and evidence depth of this kind of content serves you, subscribe to Golden Glow Senior before you leave this video. There is substantially more coming on kidney health, metabolic biology, cardiovascular protection, and the evidence behind what actually protects health in the decades after 50. This channel exists for people who want the mechanisms, not just the headlines. Subscribe now so you see the research as it comes. Here is the complete picture. The aging kidney, progressively losing filtration capacity across decades, operating with reduced nephron reserve, embedded in a population where hypertension and type 2 diabetes are increasingly prevalent, is uniquely vulnerable to 4 specific and well-documented threats. Physical inactivity reduces renal blood flow and drives insulin resistance, creating the metabolic foundation for diabetic nephropathy. NSAIDs suppress the prostaglandin-mediated dilation of renal afferent arterioles, causing recurring ischemic stress on glomerular tissue under chronic use. Excess dietary sodium elevates blood volume and sustains the hydraulic pressure that mechanically damages the glomerular filtration membrane over years. And chronic overconsumption of sugar and refined carbohydrates, through glycation of the glomerular basement membrane, fructose-driven blood pressure elevation, NF-kB-mediated inflammatory activation, and obesity-induced hyperfiltration, represents the most comprehensive and destructive coordinated attack on kidney tissue available from any single dietary pattern. All 4 of these threats are modifiable. None of them require waiting for a diagnosis to address. The biology of kidney protection is not complicated. It requires movement, informed medication use, sodium awareness, and the single most impactful dietary change available to most people over 50. A meaningful reduction in added sugar and refined carbohydrate load. Your kidneys have been working without complaint for every year of your life. The research gives us a clear picture of what they need in return. Act on that picture before the silence ends.